Hi, this is Douglas. I'm a physical therapist and running coach bringing you another informative Healing on the Run running form correction video for IT band syndrome. In this video, I have two examples of runners that came to see me specifically to help solve their IT band pain that was manifesting at the knee. Both of them had exhausted other therapies and the internet in trying to resolve the pain. IT band pain is a common injury for runners. It is mostly attributed to excessive tension on the iliotibial tract, a band of dense connective tissue that attaches at the pelvis, ensheaths the fascia lata muscle at the rim of the pelvis, attaches to the lateral edge of the gluteus maximus muscle, and extends down the outside of the thigh to attach to the tibia on the leg just below the knee. The fascia lata muscle controls the tension on the IT band. The pain, which can be fierce at times, occurs on the outside of the knee. This pain can become much worse if the common peroneal nerve gets inflamed. With IT band pain, anything not working properly in a person's muscle balance at the hip and running form that increases the stress at the knee joint could be a contributing factor. I have found that there is usually 2 or 3 form issues to be addressed. Let's take a look at these clips and see what it took to resolve the pain. The first runner, a long-time competitive runner, had chronic IT band pain in the right knee. Taping strategies weren't able to get at the problem. Drawing your attention to the still shots of his initial visit, you can see that when he is in mid-stance on the right leg, his right hip sways out, or lateral to his intended forward motion. His entire torso bows out to the left, and his right shoulder also drops to the right. Then, in mid-stance on the left leg, you can see the stability throughout the left side of his body. This set of compensatory changes on the right side of the body throw the knee out of alignment, causing increased tension at the iliotibial tract and increased stress on the lateral aspect of his right knee. These compensations are linked to muscle imbalances in the right hip in strength, timing, or both. The correction of the lateral right hip can involve balancing and strengthening exercises in addition to finding the right visualizations and focuses to use when running. What I have found with runners that have this pain is that they usually create additional stress at the knee with other biomechanical errors that add up to the pain situation. And by correcting these, the pain will fade and buy time and space to correct the one-sided hip imbalance. Looking at the side-to-side stills before and after, you can see on the left that he is striding out front with a definite heel strike. On the right, he has corrected the heel strike. In the second set of stills, you can see his shoulders are drawn up and back in the frame on the left, and on the right frame, his torso is leaning forward and his shoulders are relaxed down and forward. These corrections decrease the forces at the knee joint considerably, eliminating the pain. And again, in slow motion, you can easily visualize the ease of motion and fluid changes to his running gait. Our second example, a competitive multi-sport runner, also presented with right knee IT band pain. Looking at the left half of the screen, you can see her hips are held back, her shoulders are back, chest pushed out forward, and a bouncy running gait that is characterized by a lot of muscle holding and tension. You could say that she is trying to run forward but pulling back at the same time. This doesn't allow her to tap her power and force to move forward. You can see this holding back in the next set of stills. In the first set, you can see on the left that she is in mid-stride, is heel striking with the bulk of her body mass behind the footfall, causing increased forces of impact at the knee and other joints up the chain. In mid-stride on the right, you can see her body forcefully directed forward, a shorter stride out front, and a mid-foot strike. Now, looking at mid-stance with a vertical line drop down from the shoulder, you can see how the knee will have to bear the weight of the torso as it translates over the planted foot. On the right, this weight-bearing moment will be considerably less. Now, looking at her from the back, you can see the same lateral sway of the hip to the right as with our first example. Viewing the still shots, you can see by the drawn lines a few interesting things. First, that her right hip is out to the side when weight-bearing on the right, and her left hip drops, causing the horizontal line drawn at the waist to drop to the left. The second thing to look at is that the lines drawn down the thighs reveal a thigh that rotates inward in stance, and then increased rear foot pronation on the right, and more neutrality and stability on the left. So, as with the first runner, the IT band is overworking to stabilize and compensate for the imbalance in the right hip musculature. Looking at the hips in slow motion, you can see the increased mobility of the pelvis and increased core engagement in the running gait. This important change decreased the demand put on the peripheral muscles and structures of the leg for production of force and power, eliminating a lot of the stress at the knee and resulting in much smoother and fluid form. This also allowed her, in addition to eliminating the knee pain, tap her potential as a runner for improved performance. In summary, the important areas to look at with IT band issues are stride habits, holding in tension, especially in the upper torso, and imbalances in the hip musculature. And although this imbalance may need to be addressed through non-running related exercises and posture work, by correcting the other biomechanical factors, the pain can often be resolved. In addition to this, working on the general form issues can often help to correct the one-sided muscle imbalances. To work with running injuries using the Healing on the Run approach, it is best to consult with a professional who has an understanding of the injury, your running form, and your current training and goals. I work out of Lafayette, Colorado, and can be contacted through my website at radiantrunning.com.